everyone. Thanks for joining today. Welcome. We have a few housekeeping items. So during our time together today, please keep yourself muted unless you need to speak. Use the chat to make comments or ask questions. Questions and comments will be addressed during the last 10 to 15 minutes of the session when the video recording will be turned off. Refrain from disclosing personal details. If you have questions, ask them in a general manner or systemic. Let us know if you have any accessibility needs or need help turning on closed captioning before the session. Okay, 1 second. My name is Cindy Deitch. I'm with the PEAL Center. I'm going to start off with our partners and have Jill introduce Mission Empower.
Thanks so much, Cindy. Hi, my name is Jill Harinda Patton. I am the Executive Director of Mission Empower. We are a community parent resource center serving children and youth and young adults with disabilities and their families and professionals who work with them in Erie County, Pennsylvania. Within our community parent resource center, we support families and youth to understand the special education process, to know their rights and responsibilities, and to understand the IEP process. We provide trainings, information, leadership, and most of all, our mentoring, and we can even attend IEP meetings with families. We also have a Youth and Vision program where youth are empowered through trainings and activities, volunteering to grow into productive, independent adults who are their own advocates. We have Mission Read, which is a tutoring program. It uses the Barton reading system and teaches children how to read who have dyslexia or dyslexia-like tendencies. And then finally, we have a mission employment program, which provides group trainings and paid internships for young people with disabilities, so they are prepared for a meaningful career. And thank you so much.
Thanks a lot, Jill. Our next partner is the ARC of Pennsylvania.
Thanks, Cindy. I'm Nicole Turman, the program director of the ARC of Pennsylvania's initiative Include Me. We provide, we're an initiative of the ARC and funded by the Department of Education's Bureau of Special Education to provide support to school districts and families that volunteer for our program to increase their inclusive practices within the district. Include Me is a research-based program that published its 10-year research report in 2020. Our program specialists provide consultation, mentoring, modeling to general ed teachers in the classrooms to include students with disabilities in those general ed classrooms. Family engagement and support. We offer a lot of professional development for teachers, other school personnel, paraprofessionals, and families. And in addition to our traditional Include Me activities, we have a couple statewide initiatives. Our Disability Acceptance Through Literature program offers book studies to all Pennsylvania students across the state, those with and without disabilities, virtually, looking at book studies, groups, young students, 5 to 8 year olds. We have a study coming up that's starting in September, as well as a study on the book Fish in a Tree for students 8 to 12 years old, also starting in September. Another study on the book Gathering Blue for 12 to 16-year-old students. And we do also offer studies for older students and young adults. So you can visit our website to see other titles and register. And again, it's available for all students across Pennsylvania. A second initiative that we offer is our After School Hangout program that is available for all students in Pennsylvania age 10 and up. And there's a various topic each month for the After School Hangout. The first session that'll be starting in September with the new school year is all about friends, what they are and how to make them. And again, all of our programs can be accessed on the ARC of Pennsylvania website. Thanks, Cindy.
Fantastic, Nicole, thank you. And from HUNE, Luz.
Buenas and welcome on behalf of HUNE and myself, Luz Hernandez, Executive Director of HUNE. HUNE provides bilingual English and Spanish intense training sessions, workshops. We have a parent support group called Andy's Cafe, and we also provide technical and individual assistance for families and for youth with disabilities on a variety of different topics, from all special education related and transition. We have a focus on serving the Hispanic communities of Pennsylvania, but we're not limited to just serving the Hispanic communities. HUNE also has an after-school and summer program for youth, which is virtual. It's hybrid, actually, in person and or online. It is for students with disabilities from 14 to 26 years of age. The program is called HYPE. HYPE provides youth with empowerment and assistance on the ABCs of education, which is attendance, behavior, and curriculum, with a strong transition component to adult life. All of our services, as I stated before, are hybrid and are fully bilingual in English and Spanish. Today, we have the pleasure to partner with our colleagues across the state to bring Dr. Carole Clancy. So welcome everyone, and thank you for being here with us today. Know that HUNE is here to serve. So if you need anything, please give us a call. Thank you.
Thanks, Luz. Fantastic. And thanks to everyone who's in attendance today. We are the PEAL Center, Parent Education Advocacy Leadership Center. We're Pennsylvania's parent training and information center. According to the Individuals with Disabilities Education Act, IDEA, every state has to have at least one federally funded parent training and information center, and that is the PEAL Center. The PEAL Center helps families and youth understand a child's right to a free, appropriate public education in the least restrictive environment by providing training and individual assistance. Individual assistance can be provided in any language from the PEAL Center. Additionally, the PEAL Center grows advocates to leaders in the community through our Family Leadership Institutes and Youth Leadership Academies. These parent and youth leaders go on to advocate for systems change to improve education and medical systems for children with disabilities to lead rich, active lives. When in doubt, call the PEAL Center, we can help. And without further ado, Anya's going to take over, and she's going to lead us into the presentation from Carole Clancy, Director of the Bureau of Special Education for Pennsylvania Department of Education. I'm sure Anya's, okay, there we go. Thanks, Anya.
Thank you for joining today. It is a pleasure to be back again, partnering with PEAL and HUNE for what seems like we are finally transitioning from the pandemic. Hopefully we can continue to work through these challenges imposed by the pandemic and work toward a brighter future. Pennsylvania is a source of exceptional partnerships. This slide highlights a few of the partners in the field of special education, and we are sincerely gracious for your support during the pandemic and into the future. Prior to beginning the presentation, I wanted to preface the conversation that today is based upon Pennsylvania's guidance to the Pennsylvania school entities. It is not intended to be legal advice. The presentation is organized based on the questions supplied by PEAL from their online parental submission option. Each question will be responded to from the perspective of the Bureau of Special Education in general terms. Each child is an individual, and each circumstance is unique. So there may be other pieces of critical information not shared in the questions that may have adjusted our response in some way. So for the general intent of the question, I will be providing a global response. The Bureau of Special Education is providing consideration for families to use to guide conversations with their schools. It's critical, and it's a fact, based on the principle of IDEA, that families and schools need to work together to best support each child. Before starting, I wanted to ensure the audience that you were aware of some family-friendly resources on the web. The patent system supplies resources and information under family engagement. Many of the other initiatives, such as Transition, also have parent-friendly documents and information. Feel free to peruse these at your leisure, or when you're looking for specific information, I suggest you search our website. The Office of Dispute for Resolution is listed as well. This website provides an array of supports for parents or guardians if they're having concerns with the services their child is receiving. It also discusses how to support families to navigate the system by the use of support such as IEP facilitation, mediation, and the consult line. I'll now begin to review and respond to your questions. We are aware that unfortunately many students with and without disabilities were impacted by the pandemic and it interrupted learning. Although schools work diligently to adjust and provide innovative supports, not all students were able to make the same progress as they did with in-person instruction. This isn't unique to Pennsylvania, but it's certainly a national concern. And in fact, President Biden just announced a national effort that will provide high quality before, after school, and additional summer learning or other extended learning opportunities supported through the American Rescue Plan. This isn't a new effort. Pennsylvania has been developing and implementing this initiative statewide for the past 2 years. It began with a roadmap to reopen the schools, considering a variety of supports to support students after schools have been closed for a period of time. That time period provided the COVID-19 Compensatory Services Mitigation Grant. And that grant provided additional funds to school districts to provide additional services to students that may have lost skills or not made the same progress during those school closures. As more schools opened up and we rolled into the 2021-22 school year, the Pennsylvania Department of Education issued guidance around the Accelerated Learning Initiative, knowing that all students may have been impacted to some degree. So what supports can we put into place to accelerate the learning of all students? These supports included looking at the system conditions, looking at the academic instruction, the assessments, the social and emotional needs of staff and students, and the scaffolded supports necessary to support students at all the different levels that they may be at. This initiative included extended learning opportunities over the summer, during the school day. Many districts across the Commonwealth chose to address the impact of the pandemic in one of these mechanisms. These are all examples of how the state and schools have worked to address students with and without disabilities that were not able to make the same progress as a result of the pandemic impact. However, we recognize that based on individual circumstances of the districts, of the schools, of students, there still may be students, particularly students with disabilities, that may have a need for some additional services to support the transition from the pandemic. So in the next few slides, I'll discuss ways to continue this support. One of the supports developed out of the pandemic is the concept around COVID Compensatory Services. There have been a lot of questions around how do you calculate COVID Compensatory Services, or CCS. To begin, CCS is the proactive offer of additional services by a school district to make up for lost skills or lack of meaningful progress imposed by the pandemic. It's a form of compensatory services. It is a proactive offer of services opposed to an order from a special education advisor or a hearing officer. And we'll discuss a little bit more about that later. The guidance indicates that CCS calculation is a collaborative effort with the IEP team to determine a qualitative offer of services to address the regression or the lack of progress caused by the pandemic. Qualitative meaning reviewing the level of need and making a recommendation on how best to address that need. It is not a minute-to-minute or hour-by-hour offer of services missed by the pandemic. It was recommended that the teams review the progress of the student prior to the pandemic. What were their skills then? How were they progressing before the pandemic? How were they progressing during the pandemic? What progress could the team have anticipated if the pandemic was not occurring? And comparing those factors to determine where the student was or where the student should be, and then determining what services are necessary to offer to try to narrow the gap imposed by the pandemic. This information can be gained by reviewing the present education levels of the student before, during, and after the pandemic, as well as the progress and the rate of progress students typically made. All students eligible under IDEA need to have been considered for compensatory services at some point. It was recommended that the termination be collaborative and a team decision. And if this did not occur in your child's circumstance, we would recommend you reach out to the school district and request a time to review their data and determination if you feel your child is in need of additional services. And if you've already done that, feel free to reach out to the Bureau and we can support that conversation. Now, not all students with disabilities eligible under IDEA needed or will need COVID compensatory services or comp ed. In fact, we did have multiple parents request that students continue to learn in the alternate learning mode because based on their unique needs, they made more progress than they would have anticipated. So I mentioned this just to remind us that this is an individualized decision based on the needs and the progress of each individualized student. There are circumstances where a child might have been struggling pre-pandemic, and the pandemic may have caused the student to struggle with a particular skill area more. These new or different needs may not have been an area of need on the current IEP addressed through a goal, but now the need has increased and there's greater concern around that particular skill area. During these times, the parents should discuss their concerns with the school district and determine a plan of action from there. These new or different needs may be addressed through the regular education accelerated learning support, addressed through COVID compensatory services, or the team can determine if there's a need for additional assessments to gauge how significant are these new needs related to the skill, and if the needs need to be addressed through an IEP through a goal. Parents can certainly request a reevaluation if they feel it's necessary. We also have received concerns related to the mental health needs of students. Again, this is not unique to Pennsylvania. However, Pennsylvania is proactively working to support this increased need. We know throughout the pandemic, our students, our families, and statewide data from a variety of sources that there needs to be continued mental health supports for our students and families. At the department, we support our schools with addressing these needs, as well as the continued need for connection to caring adults through our implementation of the multi-tiered systems of support with a focus of universal supports. The focus on building safe, supportive learning environments is specifically designed to mitigate adverse reactions from experience of trauma, loss, and the impact of the pandemic. There is funding directly from PDE targeted to provide local supports through the state systems of support to increase technical assistance, training, and services through our intermediate unit partners. And most recently, there were updates in the PA school code and budget, which added significant support for mental health, including trauma-informed practices. These funds will be administered through the Pennsylvania Commission on Crime and Delinquency, Safety and Security Commission, per the regulation, and the department will continue to work with our state partners to support the development of safe, supportive learning environments. There's also information regarding the long-term impact of the pandemic. There could be situations where students with mild conditions prior to the pandemic have been increased, such as anxiety. This in turn might create an increased need of support. Schools should be implementing the supports as described for all students that are having learning difficulties. Parents may also have conversations with the schools as to asking what are the supports and what are the interventions that are in place to address our concerns. There are to be scaffolded supports and extended learning opportunities to address the continued issues that may arise related to COVID. This would allow the team to see if the supports that the child is receiving as they adjust back from the pandemic are enough to remedy the increased needs prior to examining if special education is necessary or additional supports through the IEP are necessary. If a parent feels their child's condition is impacting their ability to make progress academically, socially, emotionally, they may request an evaluation from the school system to determine if their child is eligible as a student with a disability or in need of specially designed instruction and therefore eligible for special education. And there could be circumstances that the child didn't receive services prior to the pandemic, but based on the impact of the pandemic, might now be in need, best evidenced following the interventions provided through the accelerated learning to see if students with that level of support can regain where they were before. But if necessary, students that are continuing to struggle can be evaluated to see if they're eligible for services. If parents are having concern, a parent can request an evaluation from the school. But in the end, every district is different, every student is different, and we would recommend if parents are having concerns with the progress of their students, as prior to pandemic, a conversation with the school team is important. Simultaneously, school systems are required to monitor the progress of all of their students. And if there are students that are not progressing, even with supports that are in place, they're to evaluate the students that may be in need of special education services. So in summary, the schools are also obligated to evaluate students for eligibility if they are showing a need for services, and that's called child find. So we are mindful of this and schools are mindful of this. So simultaneously, there are an array of supports that are being put into place, knowing that all students may have struggled in some capacity. And school systems are looking at the students to continue that they progress academically, socially, and emotionally, and should be taking the correct actions if there's a student that is not making the progress that they would anticipate. But if parents have concerns, again, we would recommend they reach out to their school system. This question is related to students of transition age. The pandemic has impacted the ability for some students who require community-based instruction or experience in the workforce. It has reduced the amount of time they were able to do that. Last school year, there was the option through Act 66 for parents to retain their children or to have students that turned 21 and would have otherwise aged out to return for additional year. Through the passing of Act 55 for this school year, that same right was placed into law that permitted 21-year-old students with disabilities eligible under IDEA that turned 21 during the 21-22 school year or will turn 21 before the beginning of the 22-23 school year to return for another year of learning. We've received some questions based on students that are not currently 21 and how to ensure that they receive the support that they require to successfully transition from school to life if they struggled over the past 2 years. It's in this example that the Bureau would recommend conversations around COVID Compensatory Services or additional services that may be necessary to accelerate the learning of the student to ensure that by the time they are turning 21, they are prepared for that next phase of life and that very important transition. So again, BSC would recommend if families are having concerns to ensure they're having this conversation with their school system and their transition IEP team to plan in the future what additional services should be added to ensure by the time the student is 21 that they have the supports necessary to make a successful transition. Schools are required to provide a free and appropriate public education for students with disabilities. This requires them to provide programming that address the needs of the students. So we've had some questions around parents who, as I previously said, they felt as if their students made more progress when they were in one of the remote learning situations. But as they're transitioning back, districts are not having that as an option or are not offering that as an option, and there's a little bit of a disagreement between services for the student. So having said that, there's nothing prohibiting a district from offering virtual learning from students. In fact, many school systems do so, but they are obligated to ensure FAPE in a virtual learning setting. So if an IEP team does not feel that FAPE can be delivered in any setting, but particularly for these questions in a virtual learning center, that might be why it isn't being considered at this time. So if there is a disagreement among the offering of a remote setting or something that was offered during the pandemic that's no longer being offered, it just falls back on the concept that what is FAPE for this particular child and ensuring that the student is receiving FAPE regardless if it's in a brick and mortar or in a remote setting. Finally, we have worked really hard in Pennsylvania to try to be as collaborative as possible in a very difficult time. And in broad picture, Pennsylvania has done an exceptional job. Parents, schools, advocates, students, we have worked together in a very difficult time to try to ensure that students with disabilities receive the services that they are entitled to continue to make progress in school. But in such a challenging system and circumstance with the pandemic, we know that there is increased contentiousness as health and safety is feeling more comfortable. That's no longer the primary concern, and now we're dealing with the residual impact of such barriers imposed by the pandemic. So if there are circumstances where there is disagreement between what is fit for a student or what additional services are necessary, and parents feel they've exhausted every option with their school, there are additional support mechanisms that they can access. The first, there are advocacy groups that are strong support systems for our families. PEAL and HUNE, Mission Empower, the ARC are all examples that were on the first slide. They know the system very well, and they have been very successful at supporting schools and families through this difficult situation. So we would certainly recommend you could reach out to them to have some support. There is an email directly to the Bureau, and that will be on the next slide. That email has served as a very quick way for parents to receive some support from the Bureau of Special Education. Every email comes directly to me. I read every single one of them, and then we sort them out based on region, and then that advisor reaches out to the parent and has a conversation about what their concerns are, and if they would like the advisor to support them by reaching out to the school district, or at least making sure the parent is aware of what their rights are and what other options or procedural safeguards are available to them. A third support system is Consult Line. That number will be on the next slide. That is a phone number that parents can call, and experts in the area of special education in Pennsylvania are there to support the parent with their questions and provide some advisement or possibly a direction where they can get their answers met. There certainly is a formal complaint. It's on the Bureau website. If a parent wants to file a formal complaint with the Bureau of Special Education, they would fill out the documentation. We would then review the complaint and do an investigation and have findings after the investigation. There's the Office of the Dispute Resolution, and they provide supports for families. They can provide a facilitated IEP where somebody would come in and support the IEP team to develop the IEP. They provide mediation, which would be a neutral party to support a conversation. And then there's the option of due process, which a hearing officer would make a determination on the area of contentiousness. So here are a few of the numbers that I just went over that are available for you to use. I hope that this presentation provided some insight and some clarity on some of the questions that are still resonating from the pandemic. And I am certainly looking forward to the time when we can feel we're fully beyond and moving forward with the progress of students with disabilities, removing the barriers that this pandemic has imposed. So thank you very much, and I'll certainly take some questions.